These labor electrodes are placed on your back by either a person who is present or your husband when you have contraction pains. The electrodes cover the nerve roots for the cervix and the uterus. To put them on, it is important that the skin needs to be cleaned first before the electrodes are applied. To do that, we have got a clean coat wipe which contains alcohol and silicone. The alcohol cleans the back and the silicone leaves a fine coating behind which does not wear off that quick, makes it a good conductor, it protects the skin and stops the sweat getting under the electrodes. So when you put them on, it is important, open up the wipe your back, make sure that the person that wipes your back throws away the tissue, as the alcohol, if left on the table with the tissue, will damage the surface. That is a very unbonding experience when you come home. So make sure that you throw the tissue away after your back has been cleaned. The electrodes, they are peeled off the backing sheet. The backing sheet is Teflon coated. And then it is placed on your back with the cable up. The cable is then connected to the interconnecting cable for the stimulator. When you take off the electrode, always make sure that it is placed on the backing sheet. Right, in order to apply the electrodes, we open up the wipe, making sure that it does not go onto any wooden surface. The wipe itself has got alcohol, and we wipe the back on each side of the center spine where the electrodes are going to be fitted. So in order to wipe it, we wipe right down from the cheeky bits, right down from the dimple, upwards all the way, and then go across as well to make sure that we cover completely the whole back. That will take 10 seconds to dry. In the meantime, make sure that you throw the tissue in the bin. Having done that and come back, you now take the electrodes and you place the electrode one finger to the right of the center spine, and you go upwards from the dimple on the cheek just below, here's the coccyx, below the coccyx. Place it on and slowly stick it down, make sure it's nice and flat and straight. And that is the first one. Now 1 finger's width on the other side of the spine, making a total of 2 fingers across. You now put it with the cable upwards. Make sure the cable is up. Placing it down on the dimple below, and then go all the way, slowly take it up so it is 2 fingers apart, and right from the dimple on each side. When the electrode is connected onto your back, always make sure that the cable goes upwards, because if you have the cable going the other way around, you will only feel uncomfortable having to sit on the plugs. So both electrodes are fitted vertically with the cable up as shown. We are now ready to connect the cable plug. The plugs go into the sockets, color is not important, and simply twist the cable in. One, twist in the other one, and we are ready to go. Having connected it, we can now lower the cover, and Limor will be ready to use the stimulator for her contractions.